Hi everyone, my name is Michael Monahan and I'm the chair of the Pharmacy Practice Department. Today we're going to continue with the new faculty orientation process by discussing what we do for annual evaluations. Now I know when I was a young faculty person, annual evaluations cause some anxiety, so the purpose of this presentation is to orient you to the process, help you be prepared, help you understand the focus and reason we do annual evaluations, and hopefully make it smoother. Now, you may ask, why do we do annual performance evaluations? Well, we do them for these 5 reasons here listed on the slide. First, we do it to determine individual progress. The purpose of the annual evaluation is to help you meet your goals. Now, for most of it, it would be rank. The annual evaluation process helps you keep on track, developing yourself in scholarship, service, clinical practice, and teaching skills. I also use it to determine overall departmental progress in terms of scholarship or teaching evaluations, so it's important to us as a department. It also helps us look at plan improvements. Are there some skills or other resources that are needed to help the department's overall progress in terms of faculty development? And so the annual evaluation process allows me to look at the needs of everyone in aggregate. So plan improvement is another purpose of doing annual evaluations. They also play a minor role in determining merit performances. Obviously, you want to do well so you can make more money. Here at Creighton, we have a merit-based raise process, and then the evaluation process does play a part in decision-making in terms of merit raises. And rarely, but sometimes we need to actually make personnel decisions in terms of separation from the university, and obviously the annual evaluation process is important in documenting the specific factors in that decision. But the single most important purpose of doing annual evaluations is to provide feedback for you. Now, this feedback isn't necessarily positive or negative, it just is constructive criticism to help you continually develop yourself as a teacher, a clinician, someone providing service, and someone in the process of scholarship discovery. And again, it's constructive. The whole purpose is to help you become better. So again, it's a formative process. It's something that we do every year for the purpose of making you better. It isn't summative. It isn't something like a rank and tenure evaluation. It's solely to make you better. So it's a continuous quality improvement process we use so that all our department personnel continue to grow and meet their specific goals. So ideally, the annual evaluation process actually leads to and is a key component of your career success. Again, as I said, you can see on this slide, it's a tool for personnel development. It's a means for us to give you feedback so you continue to grow as a faculty member. These are shared only between you and me as a department chair. The dean never sees any of these documents. And the last reason that we do performance evaluations is mandated by the university. So what's the typical evaluation cycle look like? Well, individual planning documents within the institutional context are used. And what's that? That's a fancy word for a faculty activity report. We use the electronic form, and what this does, it gives you the context or the place to put your goals, your accomplishments, and your professional development activities over the previous year in a similar format so that I can make some comparisons from last year to this year. So it's a template for you to put all your activities and accomplishments in. Then what we do is set up an hour-long discussion to discuss the document that you had turned in, your faculty activity report. From that, an evaluation is prepared and given verbally, and there is a process for you if you would like to counteract or give further information why you may or disagree with the particular findings that I had. So, how should you prepare for your evaluation? Well, I recommend that you do a self-evaluation as well. That self-evaluation will help you look at what you did. Okay, what were my goals this year? How did I do? Did I meet them, exceed them, or not meet them? What barriers prevented me from meeting my goals if that was one of the problems with you achieving your goals? So self-evaluation is extremely important. Then we have the chair evaluation that I do. Again, the purpose is formative for your continual career development. We typically include student ratings from your teaching. Again, what can a student rate is important. So if you're looking for how well did the test match the content, how was the flow and structure of your lecture, those are important pieces of information that students can provide. But for your teaching evaluation, by the time that you decide to go for rank and tenure, we're probably going to look at some other source of data as well, as a small group instructional diagnosis or peer coach come in and look at what you're doing. So you have more well-rounded data set. But at least student ratings are something we can look at for how are you organizing your lectures or your objectives, matching your test questions, etc. And what we want to see here at Creighton is a continuous improvement in student ratings. And again, peer evaluations can be important. All these items may be used in a teaching portfolio, and during the annual evaluation process, it's an opportunity for gather these data to develop a professional portfolio or a specific teaching portfolio that you may use for rank and tenure purposes. So what levels of evaluation? What do I look at? Well, every person within the department must perform. Everyone has to participate in the three major pillars, and for our department is typically four. So that's scholarship, teaching, service, and clinical practice. And ideally, you make progress over time. We're looking at how are you getting better. The evaluation is formative. So I provide comments to help you develop all three major pillars: scholarship, teaching, service, and clinical practice if you're on a specific clinical education track that has a practice component to it. Your job description of the track in which you are describes really what you expect to do. There are efforts for scholarship, teaching, service, and clinical practice. In our department, if you're a clin ed person or clinician educator person, you have to have one peer-reviewed publication and one national presentation per year. If you're teaching research, those expectations double. So again, your job description is important because it delineates for you what are your particular goals within the department. And obviously, if you don't know what your goals are, you can't achieve those goals. And for rank and or tenure purposes, what I want to do is make sure you're excelling in at least two of the major three, or clinical practice if you're a clinician educator. So I'm looking to help you develop at least two of those three major pillars. So what else do I look at? Well, activities. What do people do? What kind of service activities are you doing professionally for the community, for the university, for the school, and even for the department? Accomplishments. What accomplishments have you achieved? Have you received any recognition for teaching, service, or clinical practice? That can be important. What's the potential impact of your activities? So again, a clinical intervention you may have had may be recognized and may be important. Probably a better example would be a particular grant that you achieved, or some recognition about the clinical impact. As you know, in our department, we have a lot of people that do service and they've received a lot of rewards. Well, those are demonstrating either the potential impact or the impact of their specific activities. And so we look at what you're doing, what you've achieved while you're doing those things, what's the potential impact of what you've done, and what actually has come about, typically as awards or honors from your activities. Again, salary decisions are not based solely on this process. I also look at where are you on the scale in terms of your salary towards your peers. So that's an important thing, that if everyone is achieving well, I try to move some of the merit raise that the pool that the department gets to persons that are behind. But we certainly do try to award merit based on your activities and efforts. But the main purpose of the evaluation process is for faculty development, continuous quality improvement to help you develop your career to meet your goals. So it's really a formative feedback process. That's the single most important outcome of the annual evaluation process. And that's I cannot emphasize that enough. That's the focus. So if you're looking at the major pillars of scholarship, teaching, service, what are you trying to achieve as a new faculty person? Well, obviously awards and recognition for scholarship would help. I look at the quantity of activities, the number of publications you have, the quality, what's the impact factor of that publication. If you're teaching research, you have to have grantsmanship, you have to have some grants activity. If you're a clinician educator person, it's not necessary, but it certainly shows your efforts within scholarship. First author is important, I think, for teaching research purposes, less important for clinician educators. And then again, if you're teaching research or clinician educator, if you've achieved funding, that's an important example of achievement or even excellence within scholarship. What about teaching? Well, obviously, again, the easiest to record and to understand are awards or other recognitions for teaching achievements. Have other faculty persons within the institution or outside of the institution incorporated any teaching innovations that you may have had? Have you ever been invited by others to come in and discuss your teaching and your methods? And evidence of student learning is difficult. You know, what are you really going to use to demonstrate the outcomes of your teaching other than grades? It's difficult with grade inflation. So evidence of teaching learning is difficult. Typically we use student ratings or peer coaching to show that your structure and approach to teaching is effective, and that's probably more important, because what evidence would you choose of student learning? It's difficult. What about excellence in teaching? Service. Well, obviously awards and recognition are another area that are easily tagged to service. Again, we look at the impact of your service. How did your activity or participation make a difference, or how will it? What's the quantity of service that you're providing? And if possible, put some kind of measurement of the quality of the service you're providing. So in summary, the annual evaluation process is really for faculty development. It's a formative process to help you continually improve as a faculty person. The major document we use is the faculty activity report, so I recommend that you become familiar with this. And we have developed specific rubrics to help you target your performance, so behaviorally anchored ratings that help you. If you want to achieve an excellence, how am I going to do that? Those performance criteria are available. So, welcome to Creighton University School of Pharmacy and Health Professions. Welcome to the Department of Pharmacy Practice, and I hope you found this orientation useful. Thank you.